Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Friday, March 12th, 2021. Around the world, cases are slightly upticking. There were 3.1 million new cases in the last week. That's about 600,000 more than the week before, as variants are likely driving spread in a lot of countries. Here in the United States, though, things remain more or less plateaued, about 430,000 cases, which is basically the same as it was last week, a couple thousand off, maybe slightly more than last week, but pretty close there. Similarly, in Massachusetts, we saw about 10,000, between 10 and 11,000 cases in the last week, which is pretty much where it was, maybe a couple hundred more. In terms of deaths, worldwide deaths were slightly up with about 64,000 new deaths, about 6,000 or so more than the week before. United States trending slightly downwards, 2,000 fewer, just 10,000 deaths, which seems odd to say only 10,000 deaths. Here in Massachusetts, we lost 255 people to COVID-19, which is 63 fewer than the week before. Looking at the case reporting around the country, using the CDC graphics now, the COVID tracking project has closed up shop. You can see that things have been on something of a plateau for a little while after the lengthy decline that was February. There is that one anomalous spike there. The state of Missouri started reporting a lot of backlog antigen testing. So that threw off the numbers for a little bit there. But on the whole, things are staying even, trending slightly down, but not really a decline that we can really call that. When we look around the country, this is looking at the daily case rate. The darker states have higher rates. These are all rates per 100,000 people. And say that speaking, it's kind of a patchwork at the moment. The Northeast is still in the higher end of that, with New Jersey apparently the highest there. Missouri is sticking out, of course, because of that that backlog data that I mentioned earlier. At the West Coast and a lot of the middle is seeing some of its lowest rates right now. But Northeast, South, still decent amounts in those areas there. When we look at hospitalizations, this is a chart of new hospitalizations per day. That is still more or less trending downwards. It is kind of leveled out a little bit. We are seeing an average of just under 5,000 hospitalizations per day in the last week. This is, of course, less than a third of what it was at the beginning of January. As you can see there, the highest 7-day average was on January 9th. We had 16,000 new hospitalizations per day on average, whereas say, yesterday was just 5,000. But again, this also seems to have leveled off there. So we need to kind of refocus and not lose our eyes on the prize, as it were, so we don't end up stalling out here instead of making more progress towards the summer. We look at deaths, though, those do continue to trend downwards. As you can see, just continuing to down. Now, deaths are always going to be lagging indicators, so we may see these level off in a couple of weeks behind cases, but still generally turning down. Where one area that's, I think, very important to take a look at is this is the deaths by age group. So this is, each line represents an age group in this chart, and the number of deaths in that group per 100,000 population. So that dark purple line there, which is the highest, is the people 80 plus. And you can see how that is always been higher than every other line. And it was, in any of the spikes, it was always the one that was hit the most. But you can see how that one has declined so much faster than any of the others below that, which just shows that since a lot of the vaccines are going in that area first, those are the people who are getting vaccinated the soonest, that's why what we're seeing there is the decrease in deaths because of the vaccine. Now that area in gray there at the end is the most recent data, so that's a little, there's a lot of things that haven't been reported yet, and that the most recent data is always the wobbliest. So I wouldn't hold too strong onto that part, but as you can see, compared to the dashed line that was 65 to 79, how that's kind of slowly tapered there. compared to the sharp drop in the 80 plus demographic. All right, so let's move on to developments because there are some big things this week. Most notably, the federal government just passed the new COVID relief bill, and President Biden has laid out some new goals and plans for relief. So in addition to all the direct payments to people and support for states, et cetera, President has laid out a goal that all states should be able to make the vaccine eligible to all by May 1st. Now, Massachusetts is hoping to be a little bit ahead of that curve, but important to know that mass vaccinations are hoping to start by May 1st, with the president hoping for a return to some form of normal by July 4th, which means a lot of vaccines are going to have to go out in May. There is a lot of push to increase both vaccination sites and vaccinators, with like dentists and veterinarians and med students all becoming eligible to give vaccines to greatly expand the pool of vaccinators out there. Also, there is going to be a push for a federal website for enrollment rather than the individual state ones, and a helpline set up for people to call into if they can't get on through the website. On the news, the AstraZeneca vaccine is continuing to experience struggles as several countries in Europe, including Denmark and Iceland, have stopped use of it, citing a potential link between the vaccine and blood clots. There has been no proven link to this yet, but there is some worry about it, although there is definitely a proven link between COVID-19 and blood clots. So there also, there is a lot of AstraZeneca vaccine sitting in warehouses in the United States where it is not yet approved. And so there's some push back and forth about whether that vaccine should be shipped over to Europe or Africa or somewhere else where it could be used, or if it should be held here to increase our own vaccine supply when as soon as it gets approved here, that we can roll it out and really push through in May. Other news, some places to watch around the world, just for some previews of what's going on. Israel is trying out vaccine passports, where you can, if you've been vaccinated, you get through a government app, you get basically a certification that you have been vaccinated, and then you can do things like go to restaurants and see how that side of strategy works in the real world. There's some push back and forth of that, such as, what then becomes, the maitre d's job is to suddenly confirm your documentation that you've been adequately vaccinated, and that's, well outside what they're being paid to do. Plus also things like, well, can people who have not been vaccinated wait on people who have been, and the whole complicated thing there. So we'll see how that rolls out, and that will maybe guide our own plans for the future. Also, Alaska has opened its vaccinations to all residents. They've moved through all the priority phases, and now it is opening up for everyone. So that might give us a little look at how that rolls out in one very isolated area, may give some guidance for how to do mass vaccinations in other areas. Of course, it is a very small state, so it won't be that indicative, but we might be able to catch a couple of pitfalls or anything like that, see what they're doing well, and model our own rollout following that. So from the stats here, all come from New York Times, mass.gov, and the CDC. Still have COVID tracking project on that list because I never want to give them up, but unfortunately, none of them from this update. But for more from the MassSupport Network, you can find us on our website or on social media. And remember, wear your mask, wash your hands, and we'll be there if you need us. Stay safe.